Hello, I'm Shelly Dusic, current chair of Mountains of Hope, and I have no disclosures. Nationally, West Virginia now ranks second for new cases of lung cancer and third for lung cancer deaths. Lung cancer kills more people in our state than breast, colon, and prostate cancer combined. Each year, it's estimated that more than 2,000 people will contract lung cancer, and over 1,400 West Virginians will die of the disease. Of those diagnosed with lung cancer in our state, more than 74% will be diagnosed with regional or distant metastasis. So imagine our excitement when the USPSTF released their first lung cancer screening recommendations in 2013. Finally, we had a way to detect this disease early. Armed with new guidance, we knew there would still be barriers to overcome. Experience told us that just because lung cancer screening is possible does not necessarily mean it's available to those that need it most here in West Virginia. That's where Mountains of Hope Cancer Coalition comes in. We knew that with 20 years of collaborative work experience, the coalition was perfectly poised to introduce lung cancer screening to the Mountain State. Mountains of Hope is West Virginia's statewide cancer coalition. The coalition is composed of individuals and partner organizations who work to reduce the human and economic impact of cancer. Our members include state and local governments, private and nonprofit organizations, health, medical, and business communities, academic institutions, researchers, cancer survivors, caregivers, and advocates. Mountains of Hope is also the author of the state's cancer plan, and lung cancer screening was prioritized in the 2016-2020 West Virginia Cancer Plan. This allowed the coalition to establish a dedicated work group focused on developing lung cancer activities for at-risk West Virginians. Since coalition members self-select which group they choose based on personal passions or organizational goals, this gave us a dedicated and connected base to carry out the work. While many of the people needed to roll out this new cancer screening initiative were already at the table, this was not a task we could do alone. Coalition lung cancer screening activities engaged more than 297 partners, including 13 member organizations, 47 media outlets, the governor's office, community groups, and over 200 healthcare personnel, which includes lung cancer screening facilities and primary care providers. Armed with motivated volunteers, the new USPSTF lung cancer screening guidelines, and an urgent need, the coalition was ready to do something, but had no idea of what that something should be. We started with a blank page, and we asked these two questions. What do we want to do, and how do we want to do it? Answering the first question was easy. We knew we wanted to decrease the number of people diagnosed with late-stage lung cancer and increase lung cancer screening for those who were eligible. The second question was a little more difficult to answer, but our shared vision strategy grew from those early conversations and the commitments we made to root our work in county-level data for informed decision-making, to adapt and implement evidence-based interventions, to create targeted messaging and utilize a shared language that was clear, consistent, culturally appropriate, theory-based, and addressed low health literacy needs. We wanted to create sustainable change, so we nurtured relationships both inside and outside of the work group and coalition. We identified barriers and supported interventions that address the social determinants of health. We sought solutions that involved policies, systems, and environmental change, and grew opportunities to connect community members with clinical services. We also committed to measure the benefits of our activities and share best practices so that we could build lung cancer screening capacity statewide. Using these commitments as a guide, Mountains of Hope collaborated with a variety of partners to complete several key activities to promote lung cancer screening in West Virginia. We sought out projects that complemented, contributed to, or built upon the work of our partner organizations. This sharing of resources, research, and networks culminated into a multivariate implementation pilot project. In 2019, Mountains of Hope launched the project with 2 lung cancer screening facilities. The project focused on counties with high incidence of late-stage lung cancer diagnosis and recruited lung cancer screening facilities that could bill Medicare and Medicaid. We encouraged those facilities to then recruit primary care providers that were within 20 miles of the facility. The recruited facilities committed to holding a dedicated lung cancer screening event in November. The dates and duration of the events were malleable, but we encouraged them to schedule those screening events alongside the American Cancer Society's Great American Smokeout. Facilities then recruited nearby primary care providers and shared education and marketing resources provided by the work group. They completed program training, outcome reporting, and technical assistance as needed. The work group provided implementation toolkits for screening facilities and primary care providers, which contained provider and patient education, multimedia, co-branded marketing resources, and reporting forms. The toolkit also included the West Virginia Lung Cancer Care Line resource and encouraged the use of patient reminders for screening. In 2020, we added county smoking rates to our recruitment criteria and expanded the project to recruit 6 lung cancer screening facilities. We also refined the project by incorporating provider feedback to include onboarding sessions instead of training calls. And we replaced the CE video with compulsory lung cancer training sessions provided by the West Virginia Lung Cancer Project. And those who completed the virtual training received West Virginia Lung Cancer Project education and small media resources. Year 1 implementation increased lung cancer screening by 60%. And despite being in the middle of a COVID pandemic, Year 2 increased lung cancer screening by 30%. Year 2 also identified that 80% of current smokers screened were interested in smoking cessation at the time of screening. This project resulted in lung cancer screening facility and policy and protocol changes, such as targeted outreach to primary care providers by lung cancer screening facilities, the use of shared resources to implement lung cancer screening marketing strategies, changes to the electronic medical record reporting, review and evaluation of screening rates, expanded screening hours, and the establishment of referral, follow-up, and reporting procedures between the screening facilities and primary care providers. Additionally, one Year 2 facility provided a day of free lung cancer screening for uninsured patients to address health equity. This change alone increased screening for that facility by 21%. Some of the lessons learned were that screening facilities and primary care providers alike wanted more support for implementation, but felt that once the program was in place, it would be easily sustainable. And the data supports this, showing that facilities who participated in Year 1 continued to increase screening over baseline in Year 2, despite the impacts of COVID. The biggest motivator for both screening facilities and primary care providers was connecting patients to services. And all participants in Year 2 identified patients' fear of COVID-19 infection as a barrier to screening. Many facilities were unable to host or join community events that would normally be large recruiting opportunities. But by far, the largest barrier was not having dedicated staff to help facilitate implementation. While Mountains of Hope can make these resources available, we don't currently have the funding or the staffing to maintain this project. But through the project, we learned how to effectively increase screening by building partnerships between screening facilities and local primary care providers. While this has been a major success, transportation continues to be a significant barrier to access lung cancer screening in West Virginia, and with good reason. Have you ever wondered why people in West Virginia tell you how far away something is in minutes instead of miles? Well, it's because a 30-mile trip could take an hour or more, depending on which of these mountains you have to cross. The travel time required to access services exacerbates health inequities for our mostly rural population, especially with only a few lung cancer screening facilities that can bill Medicare and Medicaid. Unfortunately, this is not a problem the coalition had the capacity to address. However, a few years ago, the West Virginia University Cancer Institute, one of the founding members of Mountains of Hope, set out to add mobile lung cancer screening after looking at the success of their breast cancer screening program. They were able to use the data gathered from the Mountains of Hope lung cancer screening implementation projects to further demonstrate the need for this service. And after a long and involved process, the West Virginia University Cancer Institute is excited to announce that LUCAS, the mobile lung cancer screening unit, is scheduled to launch this summer, with opportunities for future collaboration and support on the horizon. And it's through collaboration, innovation, and commitment to the shared vision strategy that Mountains of Hope and our partners continue to forge new paths to bring the hope of lung cancer screening to our greatest treasure, our people.